Hi, good afternoon, everybody. Thank you for your time and thank you for the opportunity to present my work. I have no disclosures. So insomnia is prevalent and comorbid in the elderly, and as all of us know that nocturia is one of the most common causes of insomnia in the elderly. However, it's rarely addressed in treatment of insomnia, as are bladder dysfunction, especially in people who do not actually complain of any other lower unit tract symptoms. It's often overlooked in clinical as well as in research practices. So we decided to examine the factors associated with nocturia in healthy older women without LUTs, as well as how these bladder dysfunction or nocturia impact their sleep. So our participants came from two prospective studies that included healthy older women who were continent, and we defined our normals as women without any precipitant urgency or incontinence, who had normal results on urodynamic testing. They had adequate fluid intake, which was taken, the 3-day voiding diary, 24-hour urine output was taken as a proxy for their adequacy of PO fluid intake, as well they had a normal daytime frequency. We had a total of 39 women in our study, aged 60 to 87, of which over 50% reported nocturia in their 3-day voiding diary, and 90% of those with nocturia was attributable to nocturnal polyuria per the ICS definition. There were two factors that we found contributed independently to nocturia. One, larger proportion of the 24-hour urine output being excreted at night, which is nocturnal polyuria, with women with nocturia had a mean of 43% of their 24-hour urine output being excreted at night. And these women with nocturia also had a smaller bladder capacity, despite the fact that they had no LUT symptom to begin with. Interestingly, when we looked at the data comparing people who reported poor sleep versus good sleep, we found that patients with higher NPI reported poor sleep, which was related not so much to the time they spend in bed versus their first uninterrupted sleep period. Hence, we conclude that nocturia, nocturnal polyuria, and reduced bladder capacity are very common even in healthy older women without any other lower unit tract symptoms. And nocturnal polyuria correlates not only to time in bed, but also to decreased duration of uninterrupted sleep before the first awakening to void. Hence, the modalities to improve bladder capacity or addressing nocturnal polyuria may improve sleep even in women who do not report any other lower unit tract symptoms. Thank you.
Questions or comments? So does that mean that most of the nocturnal polyuria comes in the first part of sleep?
Yes, that's what we found in our study. And I had another study completed in women who had overactive bladder, and as far as nocturnal polyuria is concerned, we had similar findings where the nocturnal polyuria index correlated more strongly with the decrease in first uninterrupted sleep period versus the time in bed.
Other questions, comments? And the number of nocturia episodes, they were actually episodes that woke the patient up from sleep, not nocturnal frequency, but true nocturia.
No, this is by their 3-day voiding diary, the episodes that actually woke them up to go to the bathroom.
Yeah, thank you very much.
Thank you.
And then